Good morning, everyone. Welcome to NRBP's Eye Opener and today's discussion topic, Innovations in Care for Better Employee Health. Through the Eye Opener series, NRBP offers perspectives and insights from the Newark region's leaders and leading companies. We provide special and unique opportunities for our members, which helps them to be better informed on issues important to the city, the region, and to doing business. We're grateful to our series sponsor, RWJBarnabas Health, and you will hear from them shortly. We also appreciate the support of the event sponsor, TD Bank, and our media sponsor, NJ Advanced Media. Please let me know if you're interested in sponsoring a future program. We really rely on the support of our members for all of our events. Earlier this week, I took a hard hat tour of the renovations underway at Newark Beth Israel Medical Center, led by Darrell, President and CEO. It's a remarkable achievement for this long-standing institution to strengthen its already strong bond with the community and build on the award-winning medical care the hospital provides as part of the RWJBarnabas health system. Darrell, it's my pleasure to introduce you.
Thank you, Barbara. And Barbara did a great job of announcing Newark Beth Israel. I don't have much more to say after that, but I will add a couple more specifics. First, I want to thank our panelists today for taking time out. It's a very important topic for all of us. I want to give you a quick update about COVID and at Newark Beth Israel Medical Center specifically. Our patient load has vacillated between 5 and 15 patients for like the last 12 weeks. I think today we're at 10, so it feels as though we have it somewhat under control, although given what's happening in Europe, I still have major concerns about an additional surge. Proud to say that we vaccinated over 20,000 of our employees, community members, physicians, and from a system perspective, RWJBarnabas Health, we have been leaders in getting communities all across the state vaccinated. We will be standing up another mega site to make sure that we get the kids 5 to 11-year-olds vaccinated, as well as we're really pushing for boosters or third shots. It's really important in order for us to put this behind us once and for all. The other thing that I want to talk about a bit is the community relations that we have. We have really strong partnerships, as Barbara talked about earlier, with our community, and I know my colleague Barbara Mintz will talk more specifically about some of the things that we're doing in collaboration with our community partners. In addition to the more community-related activities, our tertiary and quaternary programs are very strong. Our heart transplant program is a world-renowned program. We just hired a new leader, Dr. David Feldman from the University of Cincinnati. Our outcomes have been stellar, and we're the only lung transplant program in the state of New Jersey. The construction that Barbara talked about is and we welcome anyone who is interested in a hard hat tour. If you call my office, we can make that happen for you guys. So it's really exciting here on Lyons Avenue. This is a $150 million project that will transform the community. It is the largest investment in Newark Beth Israel in well over 50 years. Brand new 17,000 square foot glass enclosed lobby, expanded emergency department, new ORs, new cath lab, and 2 brand new geriatric units. So we're super excited about this and what it's going to mean to the great care that our physicians and nurses provide daily. And now our external environment will match what's going on the inside. This project is really, and when we talked about it at the Hard Hat Tour, it is a reorientation to our community, putting the front door back on Lyons Avenue and welcoming our community into to the Beth and the great services that we have. It's been an incredible year for Newark Beth Israel. I wish everybody a very happy holidays and an even better 2022. Thank you, and looking forward to hearing from our panelists.
Thank you so much, Darrell. We really appreciate your support of this series and also for all you do for Newark, Beth, and the community. We selected today's topic as we emerge from COVID and look at new ways of work because we recognize the important role that employers can play in fostering better health for their teams. We're bringing together the leaders to discuss innovations in employee well-being. We know that social determinants of health and impacts of long-term COVID are pushing in the wrong direction. How can we reverse these trends? I look forward to hearing from all of our panelists today. It is now my pleasure to introduce Niki Patel, Medical Accounts Associate Director at NovoNordisk. She will be our moderator for today and for today's presentation and discussion. I'll come back to take a few audience questions from the Q&A box towards the end of the program, and Chip Halleck, NRBP's President and CEO, will close the program with other news about NRBP. Please remember to use the Q&A box for your questions and watch the chat for messages from our Communications Director and Vice President for Communications and DEI, Maya Curry. There'll be little hints about things that will enhance your experience today. Nikki, it's my great pleasure to turn the program to you.
Great, thanks so much, Barbara. And I'm so excited to be a part of this conversation today with NRBP. I actually grew up right next door in West Orange and went to Rutgers Business School. So familiar with Newark, and my dad still actually works there. You may, if you guys are walking around, you may see him delivering FedEx. He's been working for FedEx in Newark for 30 years. In my current role as a medical accounts director at Novo, I work with employers across the Northeast around chronic disease management and consult with them around different ways and different models of care to help achieve better outcomes for employees. And as we're talking about new strategies that employers can leverage to improve the health of people and individuals, especially in this era of COVID-19, many employers are rethinking their strategies. What can we do differently? Because we know what's worked in the past may not continue to work, right? So one of the foundational issues in healthcare that today, we're often treating downstream complications like diabetes and cardiovascular disease, but we're really not focusing on the root causes and treatment at the highest level. So today I'll share a new way of thinking about your employee health based on the latest science and data, and really what makes sense, which is looking at addressing chronic disease and healthcare from a wellness and weight management perspective. At this time of year, throughout the year, many employers are looking and evaluating their top 10 spend for healthcare, and you probably see that half of that is driven by comorbidities of obesity, like diabetes and cardiovascular disease. So first, let's take a look at the impact of obesity on employers. Next slide. So if we look at this slide, really what it's telling us is that the healthcare costs are high, there's lost productivity, and the future workforce is at risk. And this is essentially what the impact obesity has. We may not associate obesity with costs, but we're already paying for it in our healthcare spend in society. 30% of our healthcare spend is treating just the complications that are driven by obesity. Obesity is associated with higher inpatient, outpatient, prescription, workers' compensation, and disability claims costs. And the future workforce is at risk. Currently, 20% of young adults and teens have obesity, and this has been really accelerated by the COVID-19 pandemic. It's a growing problem, no pun intended. As employers, we really urge everyone, all of us as employers, pharma, healthcare, from the health plan perspective, how can we think strategically and proactively about innovative ways to improve the health outcomes of our employees and reduce future healthcare costs? Next slide. There are many factors that may explain the high obesity rates today. And you can see on the left side that in the last 70 years, our portion sizes have increased. So if you look at the hamburgers, sodas, they've tripled in size. And it really doesn't help that McDonald's, the dollar menus of all these fast food chains, they're cheaper than the healthier options. On top of this, we have sleep deprivation, stress, physical inactivity, and epigenetic modifications from processed food. And, again, the COVID-19 pandemic hasn't helped, where many of us in the last 2 years, we've gained quarantine 15, right? So, just underlying some of the issues that we see, some of the causes of high obesity. Next slide. But there is a value in an integrated approach to obesity care, and understanding how these comorbidities we're paying for actually tie back to weight and obesity. We're dedicating a lot of resources to treating the complications. 2/3 of deaths from cardiovascular disease are tied to high BMI. 30% of new diabetes diagnoses are linked to obesity, and 13 types of cancer are linked to obesity. And these are just a few of the complications. Ultimately, treating weight at the highest level or more holistically can prevent some of these complications, even sleep apnea and osteoarthritis, which are very complex. It's a high cost and really decreases the quality of life of our patients, of our employees. So really addressing it holistically, more upstream, we could have a more positive impact on these downstream complications. Next slide. So this slide, and you could build this slide out. This slide really just illustrates the chronic care model of obesity in the middle and the barriers that we face from the patient, the provider, the payer, and the employer perspective. In New Jersey, we're pretty fortunate that most employers and plans do cover comprehensive chronic care solutions for weight management, and this includes lifestyle interventions, medications, and even weight loss surgery, because we know that for high-risk individuals, these certain interventions can really improve the quality of life, life expectancy, and decrease complications. But some of the other chronic conditions we manage and we see, like diabetes, we have a whole team to support patients with diabetes. We don't have that in obesity. We really need to do more to engage patients in seeking out care. There's a lot of stigma around obesity, and people really don't feel comfortable even seeking or know that they can seek out the care for this disease. One alarming statistic that I find very interesting is that I think in New Jersey, about 30% of the 27 to 28% of the population has obesity. Less than 2% nationwide of the people that are eligible for treatment for obesity actually receive treatment. And if you look at the top right, we can see from the patient perspective, one challenge is that many people regard weight loss as their responsibility. There's a lot of stigma and bias, implicit and explicit, and I think society really needs to catch up with the science. So next slide. The final thought I'd like to leave us with is that in addition to the other challenges that I just mentioned, social determinants of health and racial diversity in healthcare is really a huge barrier. And just an example, I'd like, if we think about our employees, maybe you have a situation like this, think about 2 employees in your workforce that may have the same exact job, same, working side by side. They may be doing, working in the same office, making the same amount of money, but they live in different areas. One lives in a higher income area, another lives in a lower income area. Yet, if you look at their long-term 10-year healthcare trends, they are going in very different directions just by the fact of where they live, their zip code, and their genetic code. And really understanding these differences and being more aware, cognizant of what the impact of this is, can help us as employers, as a society, healthcare system, direct resources more appropriately to prevent the trends going in a negative direction. And from the employer's perspective, I work with a lot of employers. There's a number of different strategies that some of the employers I work with are taking to reverse these trends. One is really creating that culture of health from the top down, where employees feel more encouraged to take care of their health. Many employers offer great benefits. One of the issues is that employee engagement may be low and there's not as great of utilization of these benefits. So from the leadership down, really encouraging utilization of the benefits that you offer. My organization, we just passed our open enrollment. That's also another opportunity, maybe calling out the benefits that you offer from wellness if you offer comprehensive weight management, like we just discussed, call that out, and just raising awareness to our employees that we have these benefits, and we really should be more proactive in taking care of our health. I know a lot of employers here are probably engaging with Livongo and Noom and have medication options, have surgical options. And really we need to destigmatize the care for this and encourage our employees to do their annual checkups, their wellness screenings, biometric screenings, and really get them to providers that can take care of them. So, with that, I'd love to talk a little bit more about the disparities discussion in the panel, but I want to hear from the other panelists as well. So next, I'd like to turn it over to Dr. Mark Cunningham Hill, and he is with the Northeast Business Group on Health, and so glad to have him here with us today. Dr. Mark.
Thank you. It's a pleasure to be here today. And I'm the medical director of the Northeast Business Group on Health. The Northeast Business Group on Health is a business coalition headquartered in New York, but has members from the whole tri-state sort of area. And but what I want to talk about today is sort of build on what Nikki said and talk about some of the chronic diseases, but really talk about why now is the big issue, and some of those issues that as we come out of COVID, and I know we're all hoping that, this is we were through the last wave, but unfortunately, I think we probably have at least one more wave to go before we can say we're sort of past that. So we have some time to go with the pandemic still. But there's a few things that I think that employers need to think about now, and then how that sort of feeds into actions and some of the new innovative ways of addressing some of these issues going forward. So I just want to run through sort of some of these issues. So cost of COVID. So I think the sort of Integrated Business Institute estimates roughly about just over $50 billion is the cost of COVID. That was towards the end of last year. So you can add that, probably double that now. But it's really looking at sort of, just under half of that is like healthcare benefits, not benefits, is pay, sick pay, etc. The other half, just over half, is the cost of healthcare associated with treating COVID. So it's not an insignificant cost that's going to, will start hitting employers' benefit budgets over the coming year. During 2020, a lot of companies found that their benefits spend was down, which is now starting to increase, coming back up as things start to sort of trickle through the system and people start getting back into healthcare. There's also some of the treatments, the newer treatments that are coming out, which are really great to see. Some of the new antivirals, the monoclonal antibodies. Monoclonal antibodies are sort of $1,200 to $2,200 per infusion, plus often some infusion costs on top. The new antivirals, the Merck one is estimated around $700. We don't know what the Pfizer one is going to cost. But those, if they start to be given on a large scale, early in the disease to try and prevent hospitalization, could end up being a significant cost going forward. So there's certainly some cost aspects. And then there's long COVID, and we don't really, the studies vary from about 15 to sort of 37% that people who have got, had COVID maybe develop long-term symptoms. These are sort of last 3 to 6 months, and what that will mean for employer productivity, absence, etc., is still a little bit yet to be seen, as I think some of this is sort of being managed behind the scenes. People are sort of coping with it as they work from home, but as gradually things return back to normal, will we start to see that impact, on your workforces going forward? Missed healthcare. This is a major issue going forward. It's probably there was during beginning of the first year of the pandemic, about 60% decrease in healthcare screenings. They're already estimating that this could lead to 10,000 more cancer deaths over the next decade. So those screenings that were missed do matter. People get diagnosed at a further stage of disease. That costs more money, costs more, negative outcomes, more absence, more, adverse effects. So those are all really important. 43% of people with chronic diseases like hypertension, diabetes didn't access care during that time. Missing those sort of follow-up appointments, the check-ins, means that hypertension or diabetes that was in control went out of control, and you have all those knock-on effects. And then, and there's about another 40% of people who just missed out on other, treatment for other conditions. And then there was, on top of that, there was some negative health effects from the pandemic as well, in terms of, because people's regular habits were interrupted during lockdown, and then subsequently since then, is people's exercise has often gone down, people's, access, people working from home, people being anxious and stressed tends to drive sort of maybe some abnormal eating habits. So weight is also generally, has increased as well during this last pandemic. So that, added obesity will then add on to have knock-on effects going forward. Mental health, I think this is probably going to be a major one going forward. There was fear and isolation from the pandemic, not being able to see loved ones, loss of loved ones. There was a 400% increase in sort of anxiety and depressive symptoms compared to before the pandemic, and sort of doubling of the increase in sort of abuse, substance abuse and suicidal thoughts. So, people are very good at managing acute stress, but long chronic stress can lead to, many more sort of more serious conditions. And so this is a significant aspect, which I think employers are going to have to address going forward. The racial and social inequities piece, this is, I think the pandemic really sort of lifted the lid off this. We've known there's been racial and social inequities in terms of healthcare in this country, but with the pandemic, it really accelerated and highlighted those aspects. BIPOC communities, they tend to sort of, there's a increase chance that they're going to live in poorer neighborhoods and less well-served neighborhoods, less access to sort of healthy foods, less access to healthcare, less access to transportation. A lot of, racial and minority groups were also in jobs where they had to go to work during the pandemic. So they were, they were in the front line. They weren't able to isolate. There were more chance of getting impacted, catching COVID and then being negatively impacted. There's obviously access to healthcare, and obviously there's a trust issue. There's a genuine access issue in terms of where healthcare is. And so all these issues can tend to sort of cause issues in terms of transportation, etc. So these are all issues, I think, that as we move forward and we want to redesign healthcare benefits for your employees, that you really need to think of some of those issues, and I'll talk about those in a second. And then there's new ways of working, which I think is critical. Working from home was initially, we're going to do it for 3 months, and then everyone kept putting their office reopening, back a few months, and now some companies are even starting to say, well, we're never going to go back to fully in office. We're going to have a hybrid model. Some are even saying we're, never going to have any office space at all. Others are hoping that they'll get people back in. But because we have this work from home, this more flexible, diversity spread workforce, that impacts how we sort of, treat and how we access and how we engage employees going forward. So next slide. So this is really some of the things that we can do going forward. So I really want to talk about some of the more innovative sort of ways of things are doing. So, some of these have sort of been, most of these existed before the pandemic, but then sort of happened afterwards. So digital tools, I think, is one of those areas that's exploded over the last 10 years. And, you've all probably seen many of those tools out there, that support mental health, they support obesity, they support diabetes, they support, other chronic diseases, substance abuse. But these tools have been gradually, researched and refined, and some of them are particularly proving to be very effective. One of the advantages is, especially in sort of a diverse workforce and a separated workforce, one that's not in one place, is it allows access to healthcare resources wherever they are. So it allows that flexibility. But certainly when you come to tools that maybe tackle, issues with stigma, so Nikki talked about, obesity and the stigma around that, but also around mental health, that there's significant stigma about accessing care. But we've also found that some of these digital tools are particularly effective as well. So some of the mental health tools are, proving to be very effective. They're also quite easy to add on as a supplement to existing benefits that you might have. Certainly, they often a supplement to the employee assistance program. Even some brave, some companies are even moving to sort of replacing their employee assistance program more with a 100% digital platform. So really do encourage you to explore digital tools. The Northeast Business Group, and I'll share them after this call, we have produced some guides on diabetes, obesity, and mental health and and caregiving in terms of digital tools and how to access them and which ones, and how to assess which ones are good and how to implement them. So I will definitely share those resources after the call. Telehealth initially was one of those things that flipped at the very beginning, really important tool. It was a slow transition, and then gradually more and more, from primary care to certainly mental health, but also to specialist conditions were also being started to be treated by telehealth. Even things like physiotherapy, where you'd think you need hands-on care, very successfully launched. There's been some very successful programs with physical therapy as well. So telehealth has really proven its worth. And I think it's one of those things that's really helped access for people, certainly people who have challenging in time to get time off from work to go and see their healthcare provider. But we're already starting to see health plans starting to take out telehealth as an option. So I think it's really employers need to sort of say, hey, no, actually, I think telehealth is an added benefit. We want to keep that going forward and how best to use it. Some of the things around community resources, I think this was one of the things that was highlighted came out of COVID, was really, how can you try and get people to have access in your benefit designs to things that are close to them in the neighborhoods where they live and work. So certainly some of the companies like CVS, in terms of how they accessed and deliberately put, vaccine centers, in areas of need, was one way of how they sort of trying to equitably sort of spread some of these issues across in certain communities, certainly underserved communities. But also there's lots of other resources out there, certainly for, for more disadvantaged groups, some communities with, lower wage workers maybe. And there's some tools like Unite Us and Our Bertha, which is now called Find Help, which is like the Yelp version of being able to find resources that are to do with housing, to do with schooling, to do with education, to do with health. So there's a lot of those resources that employers can tap into, and some of those things that are there. We talked about equity a little bit. So equitable benefit design, I think, I know it's probably a little late for 2022 now, but because obviously you tend to sort of run these things in advance, but as you go into next year, some of the things you might want to think around equitable design, because it's really important that all employees, whoever they are in the company, have access to healthcare benefits. And a lot of companies have done that by saying, okay, we're going to give the same healthcare opportunities to all of our employees. That's fair, that's equal. But the cost of accessing those healthcare accessing those healthcare benefits, are greatly different from the CEO to somebody on the shop floor. That copay, that deductible is a significant barrier, and many people, avoid healthcare because of those cost issues. So really looking at sort of maybe adjusting salary-based premiums. A survey was done by Willis Towers Watson. It was about 27% in 2020 that companies were looking at this, but that increased to about 34% during this year. So it is something that companies are starting to consider and to start to look at and really evaluate how affordable is the healthcare when you take into account the living wage for those employees in terms of accessing healthcare. But also things like, high deductible health plans, which were, become very popular. They do have, there's lots of studies to show that high deductible health plans didn't really have the thing, didn't really work as they expected. They didn't really drive, people to manage their healthcare. They just got sticker shock on January 1st when they suddenly had to fork out, a lot of money for their drugs, and a lot of people then missed on treatments. So really trying to look at how you can structure those to try and encourage people to do it, to try and help them through that deductible phase, and to really own their own healthcare is really important. And then obviously some of the access issues for some of the chronic diseases. I think, Nikki mentioned the sort of the weight loss drugs. They're ones that are often not always included in the sort of standard formulary. And I think making sure that they're there and they're available and people understand how they can use them. But also for many other chronic diseases, whether asthma or hypertension, diabetes, is whether some of the, whether those drugs for maintenance therapy, the cost of those is controlled, or they outside the deductible piece is also really important. And then, then finally, I think, one of the things that really helps as you go forward is to sort of set goals and, measurements around, these targets. So, so I think that's really a way of sort of tracking these things, looking at access across different pay bands within the corporation, looking at chronic diseases, looking at things like where we know there's a lack of access, something like mental health, but also obesity, to look and track those things to make sure they happen. So setting goals. And then finally, I think the thing we did learn was that the next slide, that it's really important, and this becomes really more difficult as we go forward, is really communication. And communication, I know you've all just gone through your health, annual enrollment period where you've done all this planning, around planning, in terms of the benefit structure and going forward. I know that's always a real sort of hair-pulling, sort of hard work exercise to do, but really communication, and as we go forward, certainly targeted communication, really trying to get to the people you really want to, but also culturally appropriate communication as well, that really helps meet people where they are, I think is really important. And with that, because I know I'm probably running up on time, I ought to be quiet and shut up.
Thank you, Dr. Mark. I think there was such great pearls from your presentation. I'd like to turn it over to Dr. Peskin from Horizon Blue Cross Blue Shield to share his pearls of wisdom from the plan perspective.
Good morning, everyone. Stephen Peskin. I'm a general internist, teach at Rutgers Robert Johnson in the internal medicine residency program, and have been at Horizon for 10 years working vigorously on our value-based journey, which I'll talk about. I'll also touch on telehealth, as Dr. Cunningham Hill did. I'll also touch on social drivers, as Nikki did, and we'll hear from Barbara. And I think that's going to be the three topics. So I've got about 7 minutes, and the first slide after the intro is payment and clinical innovation. So what do we mean by that? So we're really looking at the triple or quadruple aim. So mitigating cost. I don't think we're ever going to lower cost overall, but we certainly want to reduce the rate of rise of healthcare cost and more closely parallel the consumer price index, the sort of inflation for everything else, notwithstanding lumber and some other things recently in COVID and supply chain disruption. And certainly quality is at the center. Better outcomes, and that juxtaposes to patient experience, consumer satisfaction. And really the last part that's not on here as a clinician, which I'm fully embrace, is healthcare professional sustainability, whether she be a physician or he be a nurse, reducing burnout, reducing administrative burden, and really bringing back, as Krasinski from the AMA says, bringing back joy into the practice of medicine. So the next slide is some of our keys to success. So really a huge focus on collaboration with physicians and other clinicians. We don't do this alone. We don't make all the decisions. We don't make all the rules. Really the process with the start of something called Horizon Healthcare Innovation, which was our kind of internal skunk works that's now been fully absorbed back into Horizon overall, which by the way is a 3.7 million person health plan based in New Jersey and contiguous counties. We're a not-for-profit services corporation and serve about 920,000 Medicaid persons, about 2.8 6 or 7 million commercial persons and Medicare Advantage through ourselves, and also in a joint venture with RWJBarnabas and Hackensack Meridian called Braven Health. So data and analytics at the top is vitally important, but we all know culture trumps technology, or eats technology for lunch. So again, that partnership collaboration is vital, building trust. And if you haven't read The Trust Crisis in Healthcare, which came out about 12, 15 years ago, but unfortunately is still very relevant today, I would encourage you to take a look at that. Patients, consumers, persons, we're not always patients, we're persons, and fortunately most of us don't spend most of our time in sickness care. Again, as Nikki said, focus on health improvement and wellness is a big part of this approach to population health. And so there's a lot of efforts that involve data science and data analytics. There are new payment models, which is what we've been working on, again, assiduously for the past 12 years, to pay for value or pay for performance versus paying for volume. And that's really the journey that we're going on today with our various partners, whether it be a large health system like Robert Wood Johnson Barnabas or independent primary care groups. And we're doing a tremendous amount of work in specialty care, including cancer care, orthopedics, OBGYN, and gastroenterology, and many other areas. So the next slide is a transition slide, and we've talked about, Dr. Cunningham Hill talked about some profound consequences of the pandemic. We were seeing, Mark, less than 1% use of telehealth before the pandemic, and that was mostly for acute episodic cough, cold, flu, ear infection, sinusitis, urinary tract infection symptoms, that sort of thing. And now, as you can see on the next slide, telehealth and virtual care, whatever term you like to use, has taken a much more significant role. During the darkest days of the pandemic, we were probably at, 30, 40% telehealth. Some practices were 100%. We're now leveling out at around 7%, which is, again, hundreds of folds greater than it was before the pandemic. So we have nurse chat as a possibility. We have telehealth visits, which we have on our own platform for, say, a person who is in need, doesn't maybe have a primary care relationship or a relationship with a health system. Certainly, if they do, there are many platforms out there, such as Doximity, DoxyMe, Follow My Patient. I don't want to leave anybody out, but embedded in Epic, embedded in Cerner. So many, another one called UpDocs. So, but we have our own platform in case a person comes in through our front door for medical advice and nurse chat, and then we can port that over to a virtual visit with a physician. So again, as I think Mark mentioned, it is improving access. I was asked to talk about behavioral health. We're seeing a tremendous amount of use of telehealth virtual care in behavioral health, and it is very well embraced, and I think absolutely represents a fundamental and lasting change in the way that we deliver talk therapy, and possibly prescribing as well, but certainly talk therapy. So again, there's a lot of other things around RX adherence, persistency, endurance, using virtual care, which really wouldn't necessarily be a virtual visit, more in that digital health domain that we were talking about. Next slide. So potential use cases in virtual care, again, addressing hospital at home, complex care management. We've seen since the pandemic that, again, behavioral health and also chronic condition management, such as hypertension, diabetes, are very now commonly done. So if you think about seeing a diabetic a minimum of 4 times a year, maybe 6, maybe of 6, 4 would be totally appropriate to do virtually, because you're basically just going over numbers and diet and physical activity and what the person's getting from their home glucose meter. So there's really not a lot of physical examination, certainly diabetics need to go in once a year, every other year for full dilated retina exam, getting their feet checked and things like that. But much of it can be done virtually. The last thing I'll touch on, and Mark also mentioned physical occupational therapy. There's some really cool programs out there where the physical therapist can be treating 7 patients at once, and the AI algorithms embedded in the virtual care can say that the person isn't doing the exercise or the physical therapy intervention quite right. The next slide is, I think, a break slide. So Barbara's going to get into this more, and Nikki mentioned it as well. So Horizon has stood up a phenomenal program, next slide, called Neighbors in Health. And we started in Newark, as Mr. Terry knows, and the program has been phenomenally successful under the leadership of Valerie Haar, who used to be in state government, and Tracy Paris-Benjamin and Claire Mooney and many others. So we're using the platform called NowPal. We're working in Camden, we're working in Patterson, we're working in Newark, we're working in Trenton, we're working in Gloucester and Cumberland County, really many parts of the state that we're working to advance community health worker, the PEN impact model, leveraging the thought leadership internationally known PEN impact model for community health workers. And again, addressing transportation, housing insecurity, food insecurity, health literacy. And it's really been phenomenal to see this program spread throughout the state, and working with partners like RWJBarnabas and many, many others, and St. Joe's and so forth. So I think that's my last slide. I think I kept my time close to the Barbara's Kaufman's designated 5 to 7 minutes. And with that, I'll turn it back over to you, Nikki.
Yeah, thank you so much, Dr. Peskin. Horizon's clearly doing many things to, really improve the care and lives of patients in New Jersey. I'd like to turn it over to Barbara Bergen Mintz from Newark, and would love to hear from you on what we're doing from the Robert Wood Johnson Barnabas Health Organization.
Wait till you get your first screen up there. Good morning, everyone. Again, my name is Barbara Mintz, and I am the Senior Vice President for Social Impact and Community Investment for RWJBarnabas Health. I sit in the corporate office now, but I did begin my career at Newark Beth Medical Center in healthcare and wellness, working for Darrell Terry, and working in service for our employees, our patients, and our communities. Next slide. So as a registered dietitian and a nutrition counselor in the outpatient setting there, I learned very quickly that people have many issues that determine their health status. And I think this infographic really does a good illustration, or has a good illustration of just how much someone's job status, education, healthy food access, and health behaviors can determine their health and wellness. And as you can see, 20% of this is access to quality healthcare. But I just want to add here that healthcare workers many times do a much better job of caring for others than they do for themselves. So they put their others first and foremost all the time, particularly through COVID. And even though they work in a healthcare setting, they have a very difficult time with self-care and may not always access the things that they need to stay healthy and well. Next slide. And so with that said, sustainable wellness programs really, and successful ones, really look at all of the things that affect one's health, no matter what community you're addressing. They focus on prevention and well-being in addition to disease management. They provide health status and awareness education that is culturally competent. This is very important. Meeting people where they are, because the way I see it, healthcare systems are really ecosystems. They're diverse people working at different jobs, at different education levels, different economic statuses, and they're all different, and they all need to be addressed in an equitable manner. They have to provide tools to promote positive behavior change. Programs have to also provide an environment that supports these healthy behaviors, and it needs to foster participation and accountability. They should be engaging and rewarding. And effective programs really focus on the value of the investment in addition to the return on investment, because success might not always be measured in dollars and cents. Next slide. So at RWJBH, and particularly at the Beth, we really work hard to foster well-being in our employees. And we offer programs and activities that meet people where they live, work, and play. And now we offer them virtually and on-site due to what we experienced at the height of the pandemic. Our Be Healthy program is a system-wide initiative that provides awareness and behavior change activities through a coaching and technology platform. But we also offer programs at the facility level that are not only engaging and educational for our folks, but they provide an environmental support and access to the very tools that they need to sustain healthy behaviors, not only within the hospital, but beyond. So our Beth Challenge, the Beth Farmers Market and Beth Greenhouse, Wellness on Wheels, all are programs that are at the Beth and began at the Beth and are now have expanded throughout the community and throughout our system. Next slide. So the Beth Challenge, it really is more than a contest. It has become a way of life. It started as a Biggest Loser contest for our employees, I would say 10, 12 years ago, and it's expanded the community actually right away. It focuses on achieving a healthy weight, picking the right food choices, and also exercising more frequently. So again, as I mentioned, we've expanded into the community and now are in 15 churches within the city of Newark. We're in schools as a part of our Kids Fit program. We brought it to Newark City Hall and the fire department, the Essex County Executive Offices, the State House. And as I mentioned, it's in its 12th year and going strong. It's system-wide and it's both on-site and virtual. And I think Newark Beth and the surrounding communities have lost way over 30,000 pounds that we know of. And our participants have achieved those sustainable lifestyle behaviors. We've lowered BMI, we've seen blood pressures lowered, cholesterol's lowered, and we've also been able to help people make better choices in their food, and they're exercising more. And I think one of the greatest accomplishments we did with this particular program was that we inspired our employee base to build their own fitness center on site, which is still going strong after 10 years. Next slide. So our Beth Farmers Market and Greenhouse provide that supportive environment I was mentioning. They have access to healthy and affordable food for our employees and in the community. And we've expanded our outreach even more now because we can accept food assistant vouchers such as SNAP, WIC, and the Senior Farmers Market Nutrition Program vouchers. In fact, Newark Beth became one of the first hospitals to be able to distribute those vouchers because of our partnerships with the city. We also find it a great way to reinforce the healthy lifestyle education that we provide. And some of these things have given us the motivation to open other programs that nourish our community, both from an education standpoint and a nutrition standpoint. We have in our wellness center a women's wellness pantry now that provides healthy food and education for pregnant moms in our catchment area and their families. We became a feeding site throughout the pandemic, and I think we have fed up to 2,600 women now since its inception in 2019. We also offer a lot of these programs virtually, and as for the farmers market, we were able to develop an online ordering platform just to keep our folks healthy and safe through the pandemic. Next slide. So finally, our Wellness on Wheels, or what we call our WOW van, is everything that the Beth does on wheels. It serves as a mobile health education center for our system employees and its communities. It is a 35-foot converted RV that provides healthy cooking and nutrition education. It also has a hydroponic farming demonstration table. Truly gets folks engaged, particularly the kids. And it's all our education is virtual and on site. So in summary, I really have learned over the 20 years in healthcare that it really is more than just trying to treat disease. You really have to look at prevention. It's just not enough to just be able to go after the sick care and manage chronic diseases. Offering people health prevention education, behavior change tools in a supportive, culturally competent environment is going to be the thing that will keep our communities, especially our first communities of employees, healthy and well. Thank you.
Thank you, Barbara, and thank you to all the panelists. I think this was a fantastic discussion. And I see some questions in the chat and would love to see if there is any other questions. Feel free to put them in the chat or the Q&A. Gonzalo Paz Soldan asks, in the case of obesity as a chronic disease, we know that in many cases, it starts in childhood and adolescence. Putting aside the challenges of showing a short-term ROI for a minute, how can employers begin to focus more upstream and focus on pediatric interventions? Dr. Peskin, would you like to take the first stab at it? And I'd love to chime in as well afterwards.
Sure, and Dr. Paz Solon is a pediatrician and a colleague of mine at Horizon. So Gonzalo, I'd say you know more about this than I do. I was just privileged to be at the Children's Ball last night, by the way. The American Academy of Pediatrics New Jersey chapter is always outstanding event. So it strikes me that it's a role for the community, it's a role for the schools, employers juxtaposed to children, because many of their employees have young children, but certainly not all. So I'm not sure that employer-based weight loss and weight management, I would say the employer would be more working through things like the pediatric medical home model, maybe possibly getting into rewards, although I know there's some slippery slopes there with giving financial or other rewards to children of employees, and I would defer to the Northeast Business Group on Health and Barbara Coffin maybe on some of the legalities and associated therewith. But those are my first thoughts. Again, around the community, around the school, employers may play some role based on benefit plan design, then encourage wellness and healthy nutrition would maybe be my thought about where the employer might come in.
Anybody else want to chime in on this?
Sure, I can, Barbara. I honestly think it has to be in schools because you're going to get the entire family there. It's one of the best places to affect change. We have a curriculum that's a part of the health and phys ed curriculums in schools now, and the curriculum is developed by registered dietitians and the nutrition professional and the experts. It really has been an effective model. We have a treatment model that sort of treats obesity, but I think the key to really is doing prevention and doing it in the schools where you really have a captive audience and you have the family members and the schools. It is a good microcosm to begin this kind of work, and it has to be prevention. To just treat it and chase it is not going to solve the problem.
Yeah, and I'll just add from the obesity perspective, we know that obesity, especially from, there is a huge genetic component to obesity, and from children to adults, there's a lot of stigma and bias around it, and many people, as I mentioned, don't seek out the care. And there are, I think we need to do more to raise awareness around the programs and services that are offered for both adults and pediatrics around weight management, because it's not something that we see many people don't really, may not feel comfortable or be aware that there are treatments, or there's even centers of excellence that focus on weight management. So there are providers that specialize in this, and we take a more proactive approach. I think we can really reduce a lot of the complications that really stem from childhood.
Just one other comment on the schools that I mentioned and that Barbara mentioned. There are also other types of schools. Many, not everybody is in a faith-based community, and that's your personal choice, but many are. So I would say there are different types of schools. I know certain ethnic groups have schools to maintain the language of their family of origin or country of origin. So I'd say that's another type of school where we could get some involvement around childhood obesity, which is a huge problem.
Yeah, it's a trusted source.
Definitely. So another question is around, we had a lot of discussion around the disparities in healthcare. I think everyone here touched on that. And COVID has really heightened the focus on these disparities. So, as we turn to, we talked a lot about the challenges and we touched on solutions. Let's talk a little bit about, and I'd love to get everyone's perspective on how your organization is working in a culturally competent way, and any actions that we've taken that we should be taking to address the racial bias in medicine. Maybe Dr. Mark, I'll turn it over to you.
Absolutely, love to. So I think there's, I mean, obviously there's, you know, this has been around for some time, so it's not something we can fix overnight. But I do think there's some, you know, from employers encouraging and trying to sort of get data on what data is out there, because there is quite a lot of data captured. But that often doesn't trickle down to employer level. So really understanding the social determinants of health that affect their employees so they understand what their challenges are and they can address them directly, I think is really important. So I'm a great data geek. So if we, you know, there is data, encouraging data and using data will get more, and rewarding for data to be collected at the provider end is all, I think, ways of sort of driving change, because we can actually measure change at that point. The other thing is obviously trying to develop over time a network of providers that matches, you know, so people can see people who look like them, I think is really important. And clearly that starts from going back to school again and to medical schools and who gets enrolled. So it does take some time to change that, but really trying for employers to ask for that network information about sort of the racial and ethnic mix within the, you know, within their plans provider list. It's sort of, employers pay for a lot of healthcare, you know, probably half the healthcare in the US. So I think they really can, you can flex your muscles much more than you think and push the healthcare system to do what you need it to do. So I think that's the sort of message, is don't be scared to ask. The more you ask, the more you'll get, and the more we'll start to change the system.
Definitely. Barbara, anything to add from your perspective?
No, I think medical education is key. I think if we get our physicians and our certainly recruiting physicians of color and clinicians of color, and then making sure that the medical education that they get in med school and in their fellowships and internships touch on the social determinants of health. I think in the past it has been pretty focused on the clinical aspects of being a doctor, but not necessarily the social aspects of being one. And I think that that is a huge issue. I mean, you really, as I mentioned in my comments, you really have to look at the whole person, where they're from, where they're living, their ethnicity, their race, their, you know, from a dietitian's perspective, the foods that they're eating, what foods they have access to, what education they've had, all of those things. And that isn't typically a part of medical education. And I think it needs to be.
But it's definitely improving. We talk to,
yes.
I work with a lot of different medical schools in the area, Hackensack, Rutgers, Robert.
It's coming now, but
it's definitely improving.
Still the older docs, maybe not, unless the ones that are very tuned in.
Yeah. I would echo that encouragement that Nikki mentioned. Privileged to know very well Dr. David Kuntz, who used to be at Rutgers and now is the founding dean of health equity at the new Hackensack Meridian School of Medicine. He's a great teacher and leader, and his implicit bias talk is just phenomenal. And there are other people out there that are doing this work, and certainly as someone involved with teaching of residents at Rutgers, Robert Wood, know that it's being incorporated in the curriculum. Dr. Darrell Moyer, the first woman CEO of the American College of Physicians, is another thought leader in this area. And she was pointing out that we've got a long way to go, because there are actually fewer African-American men going into medicine now than they were in the 70s.
Wow.
So I'll just speak from the pharma perspective, a couple of points addressing racial disparities. From a policy perspective, we are also advocating for change in policy. And this could include restructuring some of the, you know, the chances really to live a healthier life for people of color and racial minorities. So this includes access to therapies like anti-obesity medications. I think Dr. Mark mentioned not every employer opts into those therapies. And even in New Jersey, these therapies are not covered by New Jersey Medicaid, but many other states do cover it. Then from a clinical trials perspective, traditionally minority populations have been underrepresented in clinical trials, but we are actively increasing targets for diverse and more representative populations in our clinical trials. And then the third component is also around, you know, medication adherence, or even just engaging with providers, right? So there is cultural issues in medication adherence. So we're also doing a lot to educate on different ways to address cultural issues in medication adherence, to tailor it to different minorities, because it's not a one size fits all. I think you really do need to individualize, and, you know, as many of you said, meet people where they are. Chip had a great question as well, and he is asking, well, he shares, nothing is more personal than one's health, and communication was mentioned frequently as important. Are there any hints on how employers, including small ones without an HR department, can broach their concern for employees' health without being perceived as invasive? Any thoughts from the panelists on this?
It's a great question. I think communication is always at the heart of everything, and I'm not sure I've really got the answers. I think, any organization that could lead, if the leaders and the people who are seen as, whether that's peer leaders or actual leaders within an organization, can actually talk about health and what it means to them, and then help have that discussion. So it's really sort of building health into the conversation that happens within organizations can really help. The other thing is sometimes, obviously small, slightly larger organizations can sometimes have like employee resource groups where they have groups of employees that with an issue, and then they can sometimes help bring it up as a sort of peer conversation. But also having access to things like, as I say, some of those digital tools or some of those, easy access to resources that people don't have to go and ask somebody like an HR person or somebody else to get access. They can do it themselves, and it's easy, because that's the other challenge. If it's not easy, people won't do it. So I do think there's a lot of bits around that culture of health, that conversation that happens in organizations, and talk health in a positive way. And it's really trying to get people to be their best selves. It's not be their slimmest self or be the most muscular sort of, beach body self. It's the one that works for them, I think, is really important. But I know this is a difficult area, especially when there's sort of weight and culture interact, and there's a sort of sensitivity around the cultural messages as well as the weight messages. That can be particularly difficult. So I'm sorry, I haven't got really the greatest answers. Maybe somebody else on the panel can answer that.
No, it's a tough one, because, there's a obligation you have as an employer to an employee, or perhaps, in our case, an insurance provider and a member. So you want to make sure that you're talking to folks and you're giving them the option to buy into whatever it is you want to do for them. It has to be their decision. Health is a very personal thing. It's like when you're ready to do it, you'll have that aha moment. And in the case of weight loss, that's when you're going to do it. You might know you need to do it, but until you reach that one moment where you say, okay, now I'm going to make that change, that's what we have to help our employees do. We have to make sure that we get them to that stage of change where they are ready to take care of themselves. I think I mentioned in one of my comments about holding themselves accountable, but in a way that is nurturing and that they can trust us to help them guide along their journey.
Yeah, I think one of the challenges is just engaging employees in their health. And, a lot of organizations, even large organizations, offer a lot of these great benefits. I mean, obviously the challenge with smaller organizations, they may not have some of these, virtual apps and tools and things like that. But I think, really leadership can, set a great example and set the culture, as has been mentioned, is so important. Make it part of the thread, make it part of the culture, and employee, employees should feel that they are supported in this environment to feel at their best self. So really just walking the talk, it starts at the top, I think.
Nikki, if I may, I wanted to just go a little bit further with that question, because one of the things that's happened with COVID is that there have been more mental health issues. Mm-hmm. And I wanted to just hear a little bit more in depth about both mental health and drug addiction, because and also alcohol, because I think that we've seen that in addition to the issues around weight and obesity during the pandemic, there's also been an increase in mental health issues, loss, just a whole bunch of things that have happened as a result of the pandemic.
Yep, definitely. I know Dr. Mark had talked about this in his presentation. Any comments, Dr. Mark?
You're absolutely right. I think mental health is a major issue, and everyone's been talking about all the waves of the pandemic, and I think certainly the mental health wave is still cresting and still yet to hit everybody as it goes forward. And as I say, every single new sort of surge brings with it that sort of that additional challenges, that chronic stress that people are under, the chronic anxiety, which tends to lead to problems. So yeah, it's a really difficult issue, one we really need to address. I think acknowledging it's there and talking about these things and bringing them out into the open really does help. And doing it in a way that's sort of not judgmental, of course, but just, acknowledging that, sometimes senior leaders saying how the pandemic's impacted them, how they're anxious, how they're struggling to know when to wear a mask and not wear a mask, because, they want to, they don't like wearing masks, but they still want to keep themselves safe, or they're anxious about, what is the right thing to do because of the mixed messaging out there. So just talking about those issues, I think, really does help. And this is, I think, where some of these, telehealth, telepsychology, really gives access to things that, gives access. The data's out there and the studies are out there that it's just as effective as in-person, telehealth, psychology visits, is doing it through telehealth. The digital tools, there's still studies ongoing, but it's still looking pretty optimistic that they also work very well. It's just so much easier for people to access, and barriers, stigma and having to go and see your doctor to get a referral, or go and phone up somebody, or go and make an appointment. Just being able to see somebody, maybe initially via chat, and then that rolls into well, let's have a face-to-face video call that maybe ends up in a clinic, an in-person visit, maybe doesn't. I think all really helps to do that. So yeah, again, it's a really big issue, and I think one the pandemic has really sort of driven. It's always been there, but it's just become a much more acute issue.
Mm-hmm. Yeah, and I'll just share from our perspective. My work in the organization here, we're doing a lot around employee resource groups, which have kind of always existed in our organization, but now I think, especially with the pandemic, there's a heightened focus and more leadership engagement with these employee resource groups that really bring people together. And, we have some of those difficult conversations around racial disparities, social determinants of health, mental health, how, leadership really taking a more active role, sharing their personal stories or examples, and bringing more awareness around that. So I agree with you, Dr. Mark, that it is important and it's crucial to have that leadership involvement. But I think with that, we answered the questions from the chat, and really want to thank the panelists today for participating and sharing their expertise. And we'll close out. I think Dr. Barbara, you can close out with the session today.
Thank you to all of the panelists. You all really did a fantastic job in presenting a lot of very valuable information, and we're very grateful to all of you. Dr. Peskin asked me to apologize that he had to leave a little bit early from today's program, but we're very grateful for all the wonderful content that you shared today. And now I'm going to turn it to Chip Hallock, our President and CEO, to close out today's program.
Thanks, Barbara. And as long as I'm thanking Barbara, I'll also thank Maya from our team. They've done a great job of putting these programs together throughout the year for the benefit of our members. And to the panel, thank you so much for all that you shared this morning. Great information about all the costs of poor health to not only individuals, but businesses as well. Looking at the longer term impact of COVID, it's not over just because the cases are dropping in many cases. We've got an emphasis on the modern tools that are available to help our employees. Collaboration and the integrated approach to care is certainly having an impact in just carrying all these important tools that are available to employers to help their employees through very difficult times. And it's not a fad, as Barbara Mintz said. Sustainable wellness is very important, and the more we can all do to help our employees get that message to their to get that message to their employees and tell them about the resources and what's available to them, the better off we'll all be. So with that, thank you all again very much. To those who are watching with us, we want to thank our sponsors, RWJBarnabas Health and TD Bank, and our media sponsor, New Jersey Advanced Media. We do hope we'll see you all at our holiday networking reception on December 1st at Rutgers Ruth Gator Ginsburg Hall. We'd love to have you there. Vaccination required or proof of a test, but we would like to see you there and have you network with us all. With that, have a great Thanksgiving, everybody, and thank you again to the panel for sharing their expertise today.